So community engagement is grounded in the principles of community organizing. I think many people agree with this, and some that might be uncomfortable with community organizing need to be reminded that this is what we're talking about: social justice, and fairness, and self-determination. Go ahead. So here's the big question, always is, what is community? And I don't know how many conversations I've been in where we're like, what is community, where? Not me particularly, but there are people saying, well, what is community really, you know? I have to admit that at UNM this is often tossed around as something nearly impossible to, you know, define. These are some of the definitions or the terms that are used in this book. I think it's helpful. The systems community, the community of systems that are interdependent parts that all have a function, that are, you know, need each other and have similar sort of goal and interests. So there's the social systems, virtual systems. Can you guys guess?
Social networking groups and things like that.
Right. I think the writers of this paper were very proud of themselves that they didn't forget the virtual systems, because there was another whole chapter on it. But it is true in this day and age. I mean, now with elections and you know, organizing groups and, you know, starting movements, the internet and social networking is really important. And then there's the individual and the individual's role, how they define community or not. And I think mainly what this is talking about is that it's really complex, and that you shouldn't assume, you know, what a person thinks or feels based on what you see or what their identity appears to be, and that an individual may see themselves as part of many communities. What I think is, personally, the way I answer this question is, if you're talking about a problem or needing to engage the community around something, I think the closest and the best way to answer this question is who is affected, bottom line, who is the least able to voice what they need out of, you know, the process, or the need to get to a solution. That's who the community is that we should be concerned about, and that's how we should be answering that question.
Can you explain that the systems of seems very well connected and independent parts that represent specific functions, activities, or interests? That seems like can you give an example of that? That perspective. Perspective is?
So if you're talking about, okay, we need to address, you know, the community could be, you know, public transportation systems, or school system, or something like that. I think it's what they're meaning. And you know, this is from the framework that I'm trying to present. Personally, I felt like it was important to, you know, show you what, you know, one way of dividing up the definitions of community could be. I find most useful something that's more, you know, organic, I guess. So this, I think, is an interesting tool, and they call it a continuum that shows increasing level of community involvement, impact, trust, and communication flow. And I'm just going to go over this, but it comes originally, they've adapted, in this book, they adapted the continuum from, you could pass these around, from the, I need more, I forgot to grab it for myself.
Thank you.
From the Institute, International Association for Public Participation. And I think this is really helpful to think about, and particularly in conversations that you're having, or discussions or planning around community engagement, is what is outreach? Is it the same as community engagement? You know, what does it really mean, and to what extent are we committed to community engagement? So I just put a few of the points. Now the page that I've handed out uses the same categories across the top, but it uses some slightly different wording, and it also goes into some more detail. So why don't we look at this first, and then we can look at the paper that I just passed out. But anyway, basically it goes from outreach being providing information, making sure that there's been some establishment of communication, that there's coexistence, and basically you're just establishing a communication channel for providing information. So that's sort of a beginning level. But then to move to a consultation stage of community engagement, you're asking for feedback. So you provide information and you're interested in knowing what they think. So it moves us a little further along. The outcome is to develop more connections. And there's some sharing of information beyond just the provision of information. And then the next level is involvement, community engagement to the level of involvement, where there's more two-way communication and cooperation. It's in the collaboration stage that we get to the trust building and really bi-directional communication. You know, I know that, I don't know that I could talk about what the difference between two-way and bi-directional is, but I think the idea is that it's actually reciprocal, that there's, you know, some building on each other's points and some, you know, more, connection in the communication beyond messages that go back and forth. So there's some sharing of the same ideas and sort of integration of, you know, the ideas that are being communicated to a degree that takes it beyond two-way communication. And the outcome of that stage of collaboration is partnership building and trust building, as I said there. And then the ultimate level of community engagement is when the decision making is in the hands of the community. It's very clearly their role to be the decision makers, and there's strong partnership structures, and that the outcomes then are broader, and they can have broader health outcomes that affect, you know, the community in a way that you may not get to in the outreach stage or any of these other stages. We're getting into the principles of community engagement, and there's 9 of them, so bear with me. I hate to just read off of this, but basically, you know, that there's a clear purpose for why engagement is going to be undertaken and who it is you're trying to reach, who the population is. Meaning, we get a little more into knowing your community, but, you know, where does the action, the engagement process, where is it going to be effective in order to bring about change? So anyway, we'll get back to that. So anyway, that's the, you know, start at who and what and where. Know the constructs of that community as much as you can. I think it's important to mention here that you know, Jerry was talking about how it's important to know some of the other communities that form that community, the political structure or other economic conditions, but other sort of communities within there that are that may present barriers or facilitate your process. But I think it's important to be sure that it is a learning process, not necessarily a already deciding that there are things you can't do. So for instance, you get into the community, you're already working with the community, and the political structure is pushing back a lot, and what they need and what needs to be done needs to push against an institutional structure. Be careful that you don't find yourself saying, well, that's uncomfortable for me, so we're not going to go there. You know, that's clear, but I just think these aren't excuses or confines, boundaries. They are areas to be understood, so that So you can be very analytical about the process. And then establish relationships, build trust, and involve not only formal leaders. I think most everybody here understands that and probably has fallen in the early days of community engagement, in our experiences, fallen into that, you know, depending on formal leaders and realizing that you don't get too far. So, next slide. So these are very important ones, I think, here in the middle. Remember and accept that collective not self-determination. It's really helpful if you have a community engagement ELF. Self-determination is the right of all people in the community. So that is absolutely important to understand and to spell correctly. The other thing is important is to really understand that this is a necessary process for change and health improvement. And that all of the aspects of community and everyone engaged in community engagement needs to respect the diversity of the community. So these three principles are really getting at, you know, the respect and the trust at the community level. And then the next page. This is kind of wordy, but again, it sort of goes back to the point before that, or the point there in the middle about this is how you affect change and get to health improvement. They identify and mobilize the strengths in the community and build on the capacity of the community to make decisions and take actions. So we'll get into this a little more, but Matt's point that it may look different at the end than what you thought because it is the community's product to design and to act on. And then the organizations and individuals seeking change must be prepared to release control of the actions or interventions in the community. Usually we're not doing these as individuals. Usually we're maybe not an organization, but a team of people working on community engagement. But there has to, and we'll talk about that a little bit later, about the process that is important to go through to make sure that you're going to accept and hold each other accountable to the possibility of, you know, alterations in what you see as the final products. And not necessarily maybe the outcomes, but the way those outcomes are worked through. And it's a long-term commitment. It takes a long time. And this is always a problem because there's always, you know, funding that allows for the staffing that helps support the community engagement, and that runs out, or funding for the interventions themselves. As much as they're designed by the community, sometimes they're funded by a foundation or a university or something, and so somehow you have to work. You know, you have to be very, very careful about the timing, so that there is real understanding about the long-term commitment, but that there's, you know, some balance between the length of the funding or the length of the process that somebody is elected, or the, you know, whatever the timeline is, that you are, you know, sort of able to advocate for the longest time possible, and then support the work within a time frame. But, you know, 3 months is not long enough, ever. So it is our role to advocate for longer term timelines when we're talking about community engagement.
And so for about 15 years now, we've been placing students in projects. And so we have right now about 150 UNM and CNM students in about 30 neighborhood projects. And the emphasis is on apprenticeship. So the whole mission of the organization is leadership for community capacity building, trying to recruit young students from the neighborhood to serve in the neighborhoods they came from or similar ones, and apprentice with strong community leaders in non-profits where they get to learn and have that parallel education. They're getting one type of education at the university, and then they'll have this parallel education. So we have majors from every single college across campus, and so the health sciences one, you might be a pre-med, but you should be serving in a non-profit that's looking at affordable healthcare or creative ways of addressing some of societal problems that the whole nation's dealing with. So this gives an idea of where I'm coming from and the perspectives of my organization. And every student has to take a class when they first start on, the foundations of community engagement and trying to understand what's ethical, how to engage with neighborhoods, what, how we should be valuing community knowledge, how we can learn from the people as to what we should be doing. And we're turning it into a minor that's going to start in about a year's time, and that should help young people actually have something that they walk away with from the university that acknowledges all of the learning they had in the neighborhoods. And so we're working on that right now. There's so many phenomenal partners at the table that we're doing this with, and we want to do this with, so and become something that UNM does together. So what I wanted to share with you is some of the lessons that some of our neighborhood partners brought to us about what they think happens when community-based research is done in their neighborhoods and how it can be done in a more ethical, more responsive way. So a lot of our curriculum for our classes comes from sitting with neighborhood leaders. And so the little scenario that you have there is actually one that's adapted from one that was done with community members at the table telling us, hey, what about this? And this could happen, and that could happen. And then I sat with Danielle, and Danielle gave some input that would make it more specific to the audience that we're going to have today. So it will be more relevant to you. But it sort of speaks to the process as well, right? So if you're going to be talking about community-based research, you have to do it with community members, and you have to have them give input on what needs to happen, and not just do it to or for them, right? And I'm going to make it interactive because this is the way we do it in our Freirean ways of doing pedagogy at the university. So we like to have it interactive. We like dialogue. We believe learning happens when you're doing. We believe in experiential ed. And I'll be a hypocrite to talk about all of that and not have some interactive pieces. So what I would like is 3 volunteers to just read the scenario that's in front of you. So if I could just have 3 people, and you can just read a paragraph each so the voice kind of changes. Thank you. 1, 2, and 3. Thank you. You want to take the first paragraph?
Certainly. Lucy is a white teacher who has taught in Albuquerque for over 10 years. She accepts a position with a charter school in the Barreras neighborhood. At Garden Elementary School, she listens and learns from the strong community leaders in the neighborhood, many of whom are part of a local collaborative of students, school staff, community members, and nonprofit leaders who have been meeting on an ongoing basis at a local nonprofit to nurture a true partnership with the school. The group works hard to develop relationships and value the knowledge of all at the table. They see the collaborative as a process of self-determination for the Mexican immigrants and Chicano community in Barreras. Lucy attends all of the collaboration meetings and has become an eager and valued member of the team. She is often seen taking notes and has requested time with the members to interview them.
Thank you. Lucy is an avid gardener and had an idea to incorporate nutrition and gardening education into her classes, and she worked with a few members of the coalition to develop a curriculum. The timing was perfect because a local nonprofit had helped the school build a community garden at the school over the summer. The years go really well. Students are engaged in hands-on learning that empowers them to grow fruits and vegetables for their families. The garden flourishes and yields enough produce for children to take home and to share at the local farmers market. Lucy helps sell the produce with students and community members at the market. She becomes Teacher of the Year and for all of her wonderful work.
Lucy is invited to participate in a committee composed of nonprofit, private sector, and government agencies who are working to reduce childhood obesity. She is regarded as a community leader in the Borellis neighborhood, and is considered the representative for Garden Elementary. She works with the committee to draft a district-wide policy to include nutrition and community gardening education into the health curriculum in all APS schools. The following year, the school board votes to adopt the policy. Community members first hear of the policy when they see Lucy profiled on the local news. They feel used and see this as an act of oppression. Do you want me to?
The summer ends and the new year begins. Lucy finds the collaborative has dwindled down to just a few members. All the community members and nonprofit leaders have left the table. Morale for the project is at an all-time low. She has no idea why this would happen. Now, what I would want you to do in smaller groups, and you can actually stay at your tables, and maybe the smaller table can, split up into the other ones, and think about what went right first. I didn't even ask that question, but there are some good things in there, right, to learn from as to what went right. Think about what went wrong and why she would not know something went wrong, right? So there's something missing there that she couldn't figure out what went wrong. What could she have done differently? The obvious ones. Now the next one is a little bit interesting because it's one thing that Lucy might learn her lesson, and you might be a great friend to her and say to her, boy, did you mess up, and this is what you can do to rectify this. And that's all good and well, but there's going to be 10,000 other Lucys all around the nation doing similar things, right? So what are the policy implications of this? What kinds of changes can we make in our institutions and other spaces and places so that this doesn't happen again, or as often? And then if you had to take, now this is a tricky one, if you had to take the lessons learned from this to your own supervisor or your team, what would you say to them? Now this gets at the agency piece. I didn't mention that civic engagement is a huge part of what we want our UNM Service Corps members to do, which means taking some sort of ownership for whatever's going on, having some sort of agency, knowing how to interrupt things, and it's not just in policy ways, but it's in, in your day-to-day. What are you going to say to your team, your supervisor, your staff? Take some action. And so the only way you can do that is practice and also listening to others and hearing and getting ideas of how you might do this in your own spaces. So we might spend about 15 to 20 minutes on some of these questions, and go to the ones that speak most to you as a group and are most relevant to you, and then we're going to have you share some of the key insights from what you learned. When I do this in other settings, I also, with the younger ones, I might have them role play, and you can do that at your group if you want, if you feel comfortable enough doing that, where one of you is Lucy, and the others help as friends to figure out, okay, so this is what happened, this is what you might do, this is what went wrong, and Lucy in the role has to try to figure out what she's going to do about it, right? So if you feel comfortable enough, go for the role play. If not, the questions would be great for you to have some dialogue and discussion around.
And a lot of Chicano Mexicano people came used as an entry point into this country, being placed in the fields as as a means to change their lives, and for a white person to create the environment of replicating some of the oppressive nature of the way they came into this country, you have to have an understanding of the culture to realize how offensive that can be. And the article used the word of oppression. I would never pretend I know why this was oppressive to that community. They would have to say that. But I can see that there's a number of factors that go into creating the environments where people can recollect. I know my parents could recollect being placed in environments where they felt oppressed, but it was it was their sole means of entering into a different life, and so they took it. And so for someone to not necessarily recognize that culture and what's behind it and where the scars are and those kinds of things, that whiteness does matter. And I think it's a hard conversation for a lot of people to have, but it needs to be there.
And the hardest part is that it will surface in other ways unless we, really do sort of name it and talk about it and make it something that is relevant to the work. This isn't aside from the work. This is part of the work of us getting closer to being more human, with each other. So thank you for that. The last group.
We're going to pick the spokesperson.
That's all right. We had good discussion, so any one of you can add to.
We talked a lot about, we talked a little bit about the whole outsider-insider dynamic. And, I think I'm fortunate that in planning, we talk about that a lot. And I think, but still, I think some folks are really resistant to the idea that, maybe they suggest, why can't I go into this community and help them? And I think it's a lack of understanding of that insider-outsider dynamic on the one hand, and you talked about history, and I think we're obliged to do our best to do our research on the history of a community, because if we're talking about Barelas, like many other communities, like Santa Barbara, Martineztown, or other communities in cities across the country have experienced this phenomenon of white planners coming into a community and results become can become very negative. So there's this idea that this community may have experienced that in the past, and that's why they feel that this is a continuation of that dynamic, that oppressive dynamic. So it's really important I think for us to realize that when we go into community, it's really important to build trust, because folks are mistrusting for a reason. I mean, it's not that people of color are suffer from paranoia, beyond what's normal. It's based on a history that they've experienced. So I think it's really important for us to recognize that, and to really recognize that not just, like I said, it happens everywhere, but it happens in different ways everywhere. So to really try to locate that experience, how that experience has taken place in that specific community that you're working in.
Okay. Any other comments from that group? I know you mentioned something about the blame, right?
Blame.
On Lucy, as opposed to
institutional.
Yeah.
I mean, that she was unwittingly functioning as part of a bigger system of oppression, and that there was a lot of unconsciousness on all parts. And it's the onus is on her as a community engager to become conscious of her positionality, as you said, vis-a-vis the community. But we're Daniela said, in some ways we're all Lucy, although the race factor is, seriously important. One thing I wanted to add was that, in terms of policy implications for Cinch, that we might want to have a look beyond Lucy policy, in terms of, because we are playing the role of the committee here in paragraph 3, where we'll be reaching out to the community and trying to get them involved. So let's make sure we don't involve, Lucy's. Let's reach beyond Lucy, back to the grassroots of where Lucy came from, to be sure that we've got the people at the table who are really representative of the community.
Very good. We're all Lucy. I started thinking maybe evolution, but we are. How connected we are. Right? But there is this sense that we're all products of the system, right? We're all products of this institutional oppression that's leading to this kind of behavior, right? But us having some agency within it is crucial. You can't just you can't think, this is the institution, or this is how it is in society, or this is what happens. there has to be some points of interrupting or having some agency to make change, right? And seeing that this shouldn't happen or that kind of, and however small it is, whether she puts someone else on the committee or it shifts ideology, right, in that group. Then she can take it to the level of you always need to do this and, say this to the committee and changes some institutional pieces. And
One of the other things we talked about really briefly was the policy itself may have been or may have not been a great policy, depends how it was written. But that often we as the folks who are paid to do the engagement, we go after the low-hanging fruits because there's an opportunity. And in that sense, we're doing the same thing Lucy did, to take the easy route and pick what's important to us or what's opportune to us without really getting input. What is the most important thing to the community? And smoking cessation, people have that issue all the time. They go into neighborhoods to tell people to quit smoking. That's not often the most important or pressing thing in the neighborhood. Sometimes people are smoking because they're dealing with the stress of other things. So we're telling them to get rid of their coping mechanism without dealing with the problem, right? Because that's a low-hanging fruit and it's funded and all of those things. And obviously it's a health issue, so it needs to be dealt with at some point, but there are other things that lead to that. It's a symptom more than it is its actual own kind of disease, the way we lay it out. Even diabetes or a lot of other things are actually more symptoms of actual systematic oppression than what we end up dealing with.
so Lucy's behavior. And her egocentrism as well, right, is symptomatic. Some of the groups are talking about how, her ego gets the better of her wanting that position, or wanting that credit, or wanting those things. So.
Southeast Albuquerque, east of San Mateo, for the most part has been neglected and ignored by government, business, and up to some degree nonprofits until about the 90s. The community, specifically around San Mateo to Wyoming and near Central down to Gibson and somewhat up to Lomas had a very negative name attached to it for a long time. And a bunch of us community members have basically taken an oath not to repeat that name, so I'm not going to. If you don't know it, ask somebody else in the room and they'll tell you what it is. And people had talked about renaming the neighborhood something that was more uplifting than that for a long time. Since 2001 that I started working in public health, I remember community folks talking about naming the community something positive. There's a lot of different people who will tell you different ways that happened. I'm not going to get into that because there's often multiple histories based on perspective that people find. What did happen was at one point the community was talking about changing the name, and we happened to get 3 elected officials that were willing to look at that as something serious, as something to start moving an improvement process in the community beyond what's happened, because there's been a lot of turnaround in that community. I did some data for a class looking at homicide rates based on compilations of census tracts called heat communities. And actually that neighborhood comes out 7th, not 1st, as people assume for homicide. It's actually statistically safer to live where I live than to walk around right here where you probably feel safer. So the name went through a process. Some of the elected officials held meetings, and it came out to be called the International District. There was a proclamation at the county, the city, and the state formally naming the area the International District, with some very kind of interesting boundaries in the proclamations, but generally, again, that area between San Mateo and Wyoming. And people say, well, what's changed? Nothing's changed. People are still poor, there's still substance abuse, there's still not jobs. And that's true. But I raised my children there. And I got to hear kids talking about their life expectations related to the name of the community where they lived. Right? So there was a self-limiting thing going on mentally with the kids that grew up there. Right? Not the adults that move in and out, but the children that grew up there that didn't have a choice on what they could be in the world based on the name of their community. Right? And so now changing the name hopefully gets rid of that limitation and hopefully it inspires a different type of thinking about that. That we won't know for 20 or 30 years. And that will be highly influenced by how much work gets done to actually do the changing. Recently there's been some street upgrades and modifications on a set of streets that were recently upgraded and modified. And so, but very little of that goes east of San Mateo. Right? And so there's plans now to upgrade and modify things east of San Mateo. Now it's how do we get it implemented and actually have it happen so that people actually see the physical changes that follow the kind of mental change of the name change. Right? So essentially it's removing a barrier, not just for the adults who are going to fight about whether it makes a difference or not, but for the young people who grow up there and actually give themselves limitations or not based on those kind of stigmatizing things of a neighborhood. There are problems in that neighborhood. There's problems in every neighborhood. But again, statistically, they're not the worst as far as the danger part that people assume it to be. What happens is we don't realize when you have the densest part of the state, you're obviously going to have the highest rates of homicide and crime, or highest numbers of homicides and crime. Not necessarily rate per person. If you go to the city website, they give you rates based on neighborhood association, so amount of space. So it still looks like it's higher because it's the same amount of space and you have the same amount, there's more folks there. So it's just one part of changing stuff. And the community really got involved. And there's a lot of debates and there's still people who have issues. One of the issues that I've heard that's most interesting is you shouldn't change the name of this neighborhood to International District because then all these immigrants are going to move in. I was like, well, I don't know where you were the last 30 years, but that kind of already happened. The other one is, it sounds like a place Americans wouldn't want to live in, which I thought is really kind of an interesting take, since we just finished a conversation on racism, is really an interesting take on how people see that. And I think that's just part of the reality, is that part of what has become a very strong economic segregation by the way the community was developed and then kind of abandoned. Also, by the nature of our society, leads to racial ethnic segregation. And I think it's just important to realize that all of those things come into play, and we could argue and fight and blame people, or we could start working towards solutions. Jerry and I were at a conference where they were talking about you can give people Section 8 vouchers so that poor people can live in richer neighborhoods so that they get some health benefits. And there's research that came out this week that supports that if you move somebody out of a low-income neighborhood to a higher-income neighborhood, they actually have a health benefit that goes along with that. And one of the panelists said, well, a better way to approach that would be to eliminate poverty. And I think that's a difference between a low-hanging fruit and the roots of something. And I think that's where we need to challenge ourselves. And so since I'm hungry and need to go to do another presentation, I'm going to cut it right there. And I don't know if you wanted to do questions or not.
Do you have time for a couple questions or?
Sure. Do we have time?
I was wondering, it seems like elected officials and kind of have an agenda of the moment. Some elected officials have an agenda of the moment that, this is what we're working on and this is how that fits into this. So I was wondering what the city and county folks at that time that supported that, what angle they, what benefit they saw and proposed to renaming. Was it like a crime reduction, or I'm guessing it wasn't health improvement, but what sort of larger initiative was that considered a part of that was able to get the support of those elected officials?
Part of it is crime reduction, because that's always, if anybody goes to any neighborhood association, doesn't matter how low the crime rate is in that neighborhood, crime reduction is the major topic. But there was a lot of public health folks, the community health folks that were advocating for that as well, as part of how to destigmatize the neighborhood. So they did have that somewhat in their ear from those of us who were working there at that time. But I don't think it was the primary focus. And the other is just really how to get the area to stimulate jobs. There's a sense that it's a dead space of Central, not necessarily concerned with the whole neighborhoods, but Central. And so revitalizing that would be important. And then people assume that that will trickle out to the neighborhoods, but that's trickling out is another conversation. Daniel and then Margarita.
Was there, I find it interesting that, you know, a big point of that you're trying to make is this process of internalizing these labels, or internalizing what other folks are talking about your community. And I think that's deep. I think that's really deep. Was that part at all of the conversation within, sort of as a way to incorporate others who might not really be adept to these ideas of internalizing racism, internalizing this dynamic that you're referring to?
There was lots of conversations that were totally different, but that led us in the same direction. So there was folks that were very aware about the stigmatizing and the internalizing of stuff that were there consciously for that. The majority of folks that were there were concerned about their property values. Right? As homeowners, they were there, you know, changing this name will improve how much I can sell my house for. We just took that and ran with it anyway. You know, it was like we wanted to get it done. And it's unfortunate that there wasn't more space to have more of those conversations, but they did come up from time to time. It just wasn't as deep as we all who do this kind of work would want it to be.
You took as much space as you could.
Right, and we made sure that it was out there, that it was.
Okay, so I know there are lots of terms out there, community engagement. With the work I'm involved in, have been involved in for the last 11 years as a researcher, the term that I basically use as a research and the approach I use is called a community-based participatory approach to research. And very similar with community engagement, community organizing, community building, build upon a lot of the same principles. But I will share with you a little more from a research approach, from a researcher's approach with working communities, how we do this work, and examples. So, first off, a definition. There are actually numerous definitions out there, and when we talk about CBPR, which is the acronym for Community-Based Participatory Research, there are also other words that are used: participatory research, social action research. I mean, this has gone through a number of different versions and terms. So with the definition, I'll be concentrating on CBPR, and we like to use a definition that was developed in 2001 by the Kellogg Scholars Program. And the definition, how they define CBPR, was that it is a collaborative approach to research. There should be some level of equity or equal involvement by partners, but I'll talk a little bit about that, how that's not always true, and how sometimes it can be true, involving all partners in the research process. And when I talk about partners, again, it's research with communities, not research with an individual or on an individual. So this is community-based. And it recognizes the strengths that each partner brings. Their strengths within the community, strengths within the academy. And always should begin it with a research topic of interest to the community. And we're not looking at doing research for the sake of research, because I'm curious as a researcher, it should be of importance to the community so that ultimately our findings, you would hope, would bring social change to improve the community's health and ultimately eliminate health disparities. So in that huge definition, we'll step back and we'll talk about some of the principles. Well, when I'm talking about CBPR, we really look to our colleagues in Michigan, Israel, and they came up with a number of principles. Unfortunately, when I say I'm using a CBPR approach, I can't give you a methods book and say, do this, this, and this. I can tell you the principles I bring to the work I do. So the principles that I recognize the community has its own identity. I don't define who that community is and who should be included or excluded. They tell me. It builds on the strengths and resources of community. When I go into a community, I often tell them, you're the experts here. You know what works in this community and what doesn't. If you'll share that with me, what a privilege. So it builds on their strengths and resources. It facilitates collaborative coalition building in all phases of research, so that, again, I'll hopefully give an example of how you can do that and how we've been able to do it. Promotes co-learning, capacity building. A lot of it, again, it's research, so oftentimes communities don't have that capacity to be engaged in research. So it's developing their knowledge and their skills to be engaged in research and to be able to conduct research. And then for me as a researcher, all the time learning what are the strengths, what are the resilient factors here? How have they survived on a number of different issues? How can we build upon what's worked here? So I'm constantly learning as well. Integrates and achieves a balance between research and action. Emphasizes local relevance, and I'll give example of local relevance. Involves systems development, again, with the lens I use and the research process, not looking at just a behavior change at one level, but looking at what's happening with regard to using a social ecological model. There are many systems that are involved. And then research doesn't stop at that. That ultimately you should be able to disseminate. What did we learn? What didn't work? What worked? How do we share it? And then always, it's a long-term process. And I'll give examples of how long-term some of my research projects have been. Well, more recently, tribes have been involved in research. And they've said, well, we have our own principles as well, and they call them TPR, Tribal Participatory Research Principles. And these are some of their principles: that tribal systems should be respected and honored. Whatever type of governance is in existence, they should be acknowledged. There should be tribal governmental review and approval. This tribally specific data should not be published without prior consultation, and that the data ultimately belongs with the tribe. Again, it's coming from the academy. We often struggle with this concept, and hopefully I'll share examples. So then also that if we're going to be involved in the research process, we have some core values of trust, respect, self-determination, and reciprocity. So if I'm looking at and thinking about CBPR, oftentimes we use this little diagram to think about what it would mean. It's a constant balancing act, that there should be some levels of control, both within the academy and both within the community, and that there should be a shared decision-making process. So that when I do CBPR, that it's participatory, and it's in a partnership. It's capacity building of everybody involved. I'm also want to learn some new skills. Mutual learning. It supports community ownership, and I'll give examples of community ownership. And it's always this balance, and I'll tell you about some of my difficulties with the balance. So it's really a movement away from doing research on communities to doing research with communities. So why are researchers doing, or why is this approach even being used? Well, we know that there are complex issues, and oftentimes as outside experts, we often don't know the whole story. We don't know the context of the contextual issue of whatever the topic may be. So oftentimes, as outsiders, we don't bring the appropriate lens, and we can't just come in and hope we can correct the problem. It's more than that. We hope with CBPR to increase an interest in health disparities. That ultimately, that should be the ultimate gain, is a change in health disparities. We've seen disappointing results with intervention research, and we also have increased understanding of the importance of local context. So I'm going to jump into a program, a research project, and how this came about. So as researchers, what we do is, before we do anything, we go to the literature, and we find out what's been done and what's worked and what hasn't worked. Well, in our working with 2 tribal communities who were interested in a research in teaming up on the issue, looking at substance use and looking at families and looking at communication, well, we went to the literature, and we found within the literature a study that was funded by NIDA, and it was called the Listening to Each Other Project. And it was actually with a researcher, Dr. Whitbeck, who had conducted research with the tribal community of North. And what he did was he took what was developed as a mainstream family strengthening curriculum, and he took it and he worked with the tribal community up in the Great Lakes regions and said, can we adapt this? Actually, what really happened, according to Whitbeck, was an elder from one of the communities came to the university and said, you have this knowledge, what can we develop to address some of our issues of concern around substance use, around a number of different issues. And he went to the literature, and he found a mainstream family strengthening program that had some empirical findings. And he said, okay, well, I found this, can we adapt it? Can it make sense here? What they did was they, at the time, this is the 80s, 90s, he had, the family strengthening had actually targeted junior high age kids. So they developed a curriculum and they targeted junior high age kids. He administered the program, his intervention, and he found no difference. He conducted pre-post testing, he did a number of different types of analysis, and they found no difference. And they scratched their head and they talked about it and said, why are we finding no difference? Well, unfortunately, with the program, they realized that with substance use within this community, that they had to go younger. Prevention meant younger. It didn't mean junior high age. Junior high age, we're already experimenting, we're already using. So he had to go 3rd, 4th, 5th graders. And they had to readapt their curriculum, and they went 3rd, 4th, 5th graders, and they ran their program again, and this time he found a difference. So one of the big differences he found was, one of the most important findings is that parents and children retain preventive messages and behaviors when cultural content was integrated into the curriculum. Duh, right? Unfortunately, as researchers and scientists, that's what we need. We need empirical evidence. So we took that, and we went with 2 communities who we'd been engaged with, and we said, what if we took Whitbeck's work and if we use a CBPR approach with a Navajo community and a Pueblo community, could we also co-adapt? Could we pilot and could we implement a culturally developed intergenerational family prevention program, ultimately to reduce risky behaviors and prevention of alcohol and other drug initiation in late elementary age children? Again, the literature for him said elementary age children. We didn't know if that was true here. but we wrote the grant that way. So implications. I think using this approach is well suited for research projects, not only tribal communities, but any communities. When I present at research projects on this, when I present at conferences, and I have communities from across New Mexico, and I always get the question, why can't you do it in my community? And I'm like, I think we could. It doesn't have to be a tribal community. You all have your own history, you have your, you know, but unfortunately, you know, it's a tedious process of timing and writing the research proposal. So I think it's well suited for tribal communities, any community, because it doesn't impose academic knowledge, especially the importance of historical mistrust. I get questioned as a Native researcher as much as any other researcher why I'm doing this work. I get grilled over the coals all the time. I always ask if it's for dissertation. And I have to say up front, it's not, this isn't for dissertation purposes. It builds community confidence and trust, addresses issues of power, participation, and knowledge. Again, indigenous knowledge, contextual knowledge that's important to the communities, who they are, why they are, and what they're interested in. It identifies core tension. I acknowledge, as someone being in the academy, I have lots of privileges. There's tensions around participation, tensions around knowledge, sharing, and use of findings. I believe that using CBPR improves the use of results to improve community health. When we went to Whitbeck's work and we looked at some of his pre-post questions he asked, well, we just didn't cut and paste them and said, we're going to use them here. We told our communities, this is what they used. These are other questions that other researchers have used. Would it make sense here? And in some cases, we adapted those questions. We have a statistician on board who just wants to strangle us, but we don't want to validate those questions to where they came from, because we can't compare our community with where those questions were validated against. We want to start here, but we want the questions to make sense. So for example, within our Navajo community, depending on, I can't remember right now which question it was, a Likert scale, meaning sometimes, a little, always, that didn't make sense to them. If you're going to ask me that question, I either know it or I don't. So we had to collapse and change our response categories. So we even took the time, and that took probably another year, just to look at the questions we're asking. Do they make sense here? If they don't make sense, how do you analyze and how do you interpret your findings? So it improves the use of results. It can lead to further collaboration. Well, with the Pueblo community, they were just this program, they loved it. And they ended up getting CDC dollars, and they modified parts of it. They took and ran with it. We just co-wrote with them over the summer another research project with them, and developing a more rigorous testing of this program, so that we have a delayed comparison group. I mean, you can talk about those things with this community before, and they also realize if they want to go after research dollars, they want to publish. And they said to us, we want to publish. And we were like, oh my gosh. We're like, you want? So it was right away we wrote an article for the IHS provider, something that, you know, that was relevant, and so we wrote an article with the IHS provider, and we're writing another book chapter, but on the process itself. And they said we want to write, so we had to look for opportunities to write. That was like, that was left field, we didn't expect that. Oh my gosh, they're probably asking us to publish. Can lead to conference presentations. Again, that's one of the first things we do, whether it's IHS, or the New Mexico Public Health Conference, or the American APHA. So, where are we currently? Dr. Wallerstein was PI on the last project. We had an oversight committee that guide us in that work, and on that committee sat an Apache person who said, why can't it work in my community? And we're like, we can try. And we wrote a grant, and we got a grant, and I'm the PI of this project. And we're starting our 4th year this month. We are looking at, we developed their own curriculum, we developed their own teachings, we developed, history was huge for them. We went from 1 session to 2 sessions. We're better developing our pre and post testing. There's just so much work going on right now. We're hoping to pilot our program this winter.
Engaging our community, engaging our village can be quite a challenge. This morning's handout, it said that Lucy was a white woman. The first thing I was going to say was that at the beginning of the process of engaging our people, you need to have somebody there who looks like us, who is at the head of that process. We tend to relate better, relax more when we look up and see someone who looks like us, assisting us in this process. Needs to be someone who is known throughout the village, someone who knows the village, someone who knows the key stakeholders, the gatekeepers, some of the people who know where the bones are buried, because these people can get doors open for you that ordinarily would not be open. Someone who knows about the different resources that exist within our village. We have all kinds of resources. In Albuquerque, there are over 50 black churches in Albuquerque. There are several national black organizations, National Council of Negro Women, the Links, Alpha Kappa Alpha Sorority, Delta Sigma Theta Sorority, Omega Psi Phi Fraternity, Kappa Alpha Psi Fraternity, the NAACP. We have any number of national organizations, the Elks, the Order of the Eastern Stars. But you also need to know how else to identify resources. I only wear African garb. And so what has happened over the years is whenever I would go out into a larger metropolitan area outside of Albuquerque, one of the first things I would do would be pick up the yellow pages and identify African stores. Went into Jacksonville, Florida, identified 3 or 4 African stores, called them. The numbers were either disconnected or no one answered. Went back to the yellow pages. I identified one of our beauty shops. I called the beauty shop. I told the sister who I was and what I was looking for. She said, but baby. And baby is a term of endearment that we often use among ourselves. You know, it's not one of those sexist, racist kinds of things. You know, it's a term of endearment. She said, but baby, you called the beauty shop. I said, I know. I said, you talk about everybody and everything that's going on in the village. You know everything that's going on. And she laughed and she said, you're right. And she told me exactly where to go to. And it wasn't to either one of those 3 or 4 places that were listed in the phone book. So you have to know how to be resourceful. We have barbershops, beauty shops here who have been here for years. So you need to be comfortable enough to walk into this beauty shop and say, hey, you know, listen to me, this is what da-da-da-da-da-da-da. And that's an incredible resource, you know. Now, even within our village, you need to know that we do have our issues. And we have some very serious issues at times, you know. I, for one, believe that we are extremely reactive versus proactive. And the powers that be have begun to understand that. So what did they say now? Well, just let them go and holler for a few seconds. and then some just go home and then sit down. And unfortunately, that sometimes is the case, Several years ago, we were labeled statistically insignificant. Now, do you know how that makes one feel? No, you don't, but I do. To be labeled statistically insignificant, it feels like crap. It makes you extremely angry. It hurts deep inside. But for that to come out, and then for that label to be used to justify not providing services and/or information. We are overrepresented in the foster care system. We're overrepresented in the juvenile justice system. We're overrepresented in the jail and the adult penal system. Several years ago, I went down to the prison in Los Lunas to the Correction Industries program when they were making all this office furniture and stuff. Walked out, I got down there and stood in front of this huge gate. This was before I started wearing garb. And this electric gate slowly opened up in front of me. I had to step in, and it closed behind me, and then another one slowly opened up. And then I stepped on the yard, and I looked around. I said, oh God, I will never get out of here, because I look just like the people on the yard. And they were wearing blue jeans and t-shirts and tennis shoes just like I said, I'll never get out. We're overrepresented there, So engaging our village, it's a challenge. It's a challenge. But it is past time for a paradigm shift, because we've been doing things for the last 735 years that haven't worked yet. So why do we keep doing it? We need to change the way we are doing things. Planning is one of those things, but it can happen. It's going to take patience. It's going to take tolerance. It's going to take education. It's going to take connecting. It's going to take trusting, establishing a trusting relationship. It's going to take just boldness at times. You go in and you know what it is that you need to accomplish, but in the meantime, though, you have a plan, and you involve us. This morning as I sat here, I was thinking, am I the right one to be sitting here getting this information? Because I'm getting ready to go home and sit down, and tomorrow at the top of my list of priorities will be me, not the village. I just got through dealing with a horrible gout episode, and I learned during that time that I now have to put myself at the top of the list of priorities and began taking care of myself physically, mentally, and spiritually. So, who are you going to identify? And we need someone here to get this information, to take information back and forth to our village. Are you aware we do have a black newspaper? Are you aware of that? Has been here for years. Ronnie Wallace is the editor of The Perspective. And that paper has been in existence for years. We have a couple of websites that you can check out, but there are resources out there. But the thing about it is, you need to get out there. Just like what was formerly known as the International Village, people will avoid that. But guess what? People avoid the Kirk. The Kirk, where is that? The Kirtland edition, over there off of University and Gibson. That used to be an incredible black village. That was the one place years ago when black folk wanted to buy houses. Guess where they were referred? To the Kirk. And at the mouth of the Kirk is Mount Olive Missionary Baptist Church, the oldest black Baptist church in Albuquerque is at the mouth of that village, you know. And then you drive in the Kirk, and as you go towards the Dennis Thomas Bell Community Center, you got this incredible wall, this mural that depicts the history. It is also the one place that is not tagged by vandals. They have not messed with that wall. And that wall has been there for years. You might want to take a drive over there and go see that wall. It's an incredible depiction of the history of that village. When I brought her into New Mexico, the National Association of Black Social Workers, and we got our charter and our chapter started, one Saturday I took my people over there and we walked every street in the Kirk, saying, hello, how are you? My name is, we are the. Don't be afraid to do that. We won't, no, I was going to say we won't hurt you, just depends. But at least go over there, see the village. And there's another area of town that had this unfavorable designation, but it's the South Broadway area. And my first job was over at 1500 Walter Street. It was John Marshall Elementary School. An incredible area, but it has been labeled one of those bad areas as well, you know. But those are the areas, those are the places where we need to go. We have no central watering hole. And we are scattered. And I do believe that that has been intentional. You know, divide and conquer. Read the Willie Lynch letter. Read the Willie Lynch letter. Look it up online and read it and be very surprised.